For our starting position, some of the neck, back, and shoulder muscles involved are the trapezius, the latissimus dorsi, and the teres major and minor. The latissimus dorsi originates at the spine of the sacral, lumbar, and lower thoracic vertebrae, the iliac crest, and the lower ribs. The insertion is at the intertubercle groove of the humerus, and the action extends, adducts, and rotates the arm medially and pulls the shoulder downward and back. For our arm muscles, some involved are the brachioradialis, infraspinatus, and pronator teres. The pronator teres originates at the medial epicondyle of the humerus and coronoid process of the ulna. The insertion is located at the lateral surface of the radius, and the action rotates the forearm medially and pronates the hand. Some hand muscles involved are the flexor carpi radialis, the palmaris longus, and the extensor digitorum. The flexor carpi radialis originates at the medial epicondyle of the humerus. The insertion is located at the base of the second and third metacarpals, and the action is that it flexes the wrist and abducts the hand. Some of the glute, leg, and ab muscles involved are the gluteus medius, the external obliques, and the vastus lateralis. The external obliques originate at the outer surface of the lower ribs. The insertion is located at the outer lip of the iliac crest and the linea alba. The action is that it tenses the abdominal wall and compresses the abdominal contents. For the stage 2 movement of hula hooping, some of the muscles involved in the neck, back, and shoulders region are the pectoralis minor, the supraspinatus, and the semispinalis. The origin of the pectoralis minor are ribs 3 through 5. The insertion of the pectoralis minor is the coracoid process. And the action is that it draws the scapula forward, medialward, and downward. Some of the muscles involved in the arms are the flexor carpi radialis, the levator scapulae, and the deltoid. The origin of the deltoid is the lateral third of the clavicle, acromion, and lower lip of the crest of the spine of scapula, inserting at the deltoid tuberosity of the humerus. The deltoid abducts the arm, medially rotates the arm, and laterally rotates the arm. Some of the muscles involved with moving the hand during this stage are the palmaris longus, the flexor carpi radialis, and the extensor digitorum. The origin of the palmaris longus is the flexor tendon and the medial epicondyle of the humerus, inserting at the palmar aponeurosis. The palmaris longus flexes the wrist. Some of the muscles involved in the gluteus, legs, and abs region are the vastus medialis, the vastus lateralis, and the tibialis anterior. The origin of the tibialis anterior is the lateral tibial condyle and upper lateral surface of the tibia. The insertion of the tibialis anterior is the medial surface of the medial cuneiform and the first metatarsal. The tibialis anterior dorsiflexes and inverts the foot. For our final movement, the neck, back, and shoulder muscles involved are the deltoid, brachialis, and brachioradialis. The brachioradialis originates at the distal lateral end of the humerus and inserts at the lateral surface of the radius above the styloid process. The action is that it flexes the elbow. Some arm muscles are the pronator teres, pronator quadratus, and the subscapularis. The subscapularis originates at the anterior surface of the scapula and inserts at the lesser tubercle groove of the humerus. The action is that it rotates the arm medially. Some hand muscles involved are the flexor digitorum superficialis, the flexor carpi radialis, and the flexor carpi ulnaris. The flexor digitorum superficialis originates at the medial epicondyle of the humerus, coronoid process of the ulna, and the radius. The insertion is at the tendon of the fingers, and the action is that it flexes the fingers and the wrist. Some glute, leg, and ab muscles involved are the rectus abdominis, the adductor longus, and the gratialis.
The adductor longus originates at the body of the pubis inferior and medial to pubic tubercle. It inserts at the lower 2/3 of the medial linea aspera, and its action is that it adducts and medially rotates the hip.
4